I really started to research hair transplants and I came across Dr. Sean. He really stuck out to me. I set up a meeting with him and I was just really impressed by how dedicated he was and very thorough as well, and also listened to what I wanted. I didn't want to change my hair in a very extreme way. I'd already lost a fair bit in this area, and at this point, after consulting with him, we made a decision to do something more conservative. So to keep my current hairline and to build out from there. And I really liked his approach. And I think ultimately that's kind of what drove me to choose to go with Dr. Sean. And so my procedure is tomorrow. I'm nervous, I'm excited. He made me feel really comfortable about it, and I'm very confident in his skill set, and I'm really looking forward to the hair transplant tomorrow. One of the things that I'm looking forward to the most is not being preoccupied with how my hair looks and whether or not the sun is shining through it. If somebody's taking a picture of me from the side, just be a little bit more confident. I'm really excited about it. Obviously, a little bit of nerves, as comes with any procedure or surgery, but I'm really confident in Dr. Sean, and right now I'm just, I'm elated. I cannot wait for tomorrow to come and the next, I don't want time to fly by, but I do at the same time, because I really cannot wait to see the end result of this. It's something that's been on my mind for a really long time. And so it's the beginning of a new chapter.
Okay, so we're going to be designing the hairline. The key things are naturalness, age appropriateness, framing of the face. It doesn't really make a difference how low it is, right? The key is that bridging the gap is key. Bridging the gap, and that's what we want to do, right? Because, if we had infinite number of grafts, that'd be great, but we don't. So we have to create this sense of illusion. That's really important. So this is an art. Continuously we'll be looking at it throughout the whole day. Right, so that whole area. If I can come lower, I'll be more than happy to come lower, right? But I want to kind of begin from this area. Okay. Because even if I could see this, that you're going to lose him in this area soon, and you are unfinasteride as well. So if I can begin even further back, that would even be great, because we're accounting for what will happen in the next 1 to 2 years. Now, this doesn't mean in the future you can't lower it, but this would be the first step. Okay. Right? This is the foundation, right? Because it bridges the gap, it connects the left side to the right side symmetrically and appropriately, and that's what you want.
Okay. And so when you said during the procedure you may come down, could you explain what you mean by that?
So depending on how dense pack I can make it, which really depends on the length of the hair, thickness of the skin, right? How many grafts with 3 hairs we get, etc. Right? How many grafts I end up getting, right? If I could come lower, I just take the whole thing, I just bring it lower.
Got it.
Right? I follow that exact same pattern, I just bring it lower.
Okay.
But you don't want to begin from here and go back, it just doesn't make sense. Yep. Because you may not get, you may not actually be able to connect the back, and you're going to have a lot of gaps.
Yeah. And you don't want to move it just because of a small amount of hairs.
Yeah, just because you have few hairs doesn't mean necessarily you have to move. This actually creates a very natural look to it. But if you come down here and want to basically go to either side, this will just, from here to here, will require 2,000 grafts.
Yeah.
1,800. Because look, the circumference increases.
Yeah.
So you want to take a small area and really try to dense pack it as much as possible, right? Now, if I can bring it lower by densing everything up, that's great.
Okay.
But you need to set your foundation, and that's the foundation.
Okay.
And you have very fine hair,
Yeah.
so you have to take that into consideration.
Yep, definitely. Okay. Cool. Looks good.
Perfect. Wonderful. So the line, right, as I'm drawing, nothing goes on straight lines because that's not natural, right? So everything has these zigzag patterns to it because that's what naturalness is all about.
Okay.
And that's actually very important,
Okay.
right? So it's zigzag pattern, the ones go on the zigzag pattern line, 2s and 3s behind it.
Okay.
And that's really key.
All right. Yeah, that makes sense. And I think you mentioned that that's where you'll do the single graft
Right?
in the front.
So the single grafts are there and then up to here, right? So this whole area are graft with 2 hairs and here the graft with 3 hairs and 2 hairs.
Got it. Okay. I'm looking forward to it.
Good, perfect. Again, if I can get more, I could lower it.
Yeah, definitely.
I'll do it.
Posted.
No, I'll let you know. You'll know, right?
Okay.
I mean, it depends how much numbing you need and all these stuff. So we'll determine as we go along. See, there are a lot of things that are unknown as well, right? Good. And so just to let you know, people ask me how I figure out where, the foundation, right? Where the actual angles actually hit. It really depends on your own, facial features, right? So the angles of the hairline depend where your lateral part of the eye lies.
Okay.
Because that's what people see as natural and age appropriate, right? So, and that's how I make it.
Okay.
So when someone looks at you, it just looks natural. No, but you see, that does not look natural as you get older. It's not age appropriate, and you're going to utilize so many grafts, you run out of it. It's not worth it. So the key thing in the donor area, right? Everything's calculated, how many grafts we're going to remove basically per box, right? So everything is distributed out. So we're not removing too much, right?
Okay.
And then even in the back, when I remove the areas, nothing's done on straight lines. So everything is done on zigzag patterns, right? So even if you cut your hair short, there is no straight line, like, little dots.
Got it.
That's awesome. I'm gonna have you stand up and shake everything off. Okay, so now I'm going to have you use the restroom. Okay. And when you come back, we're just gonna give you Xanax and we're gonna get started. So we just now finished extraction and you also had lunch. How was your lunch?
Lunch was delicious.
Perfect.
Yeah.
So how was the whole extraction part?
It was great. I think I was worried going into it. I didn't know exactly what to expect, but there was a lot of numbing, which was great. And anytime if I did feel anything, you were great. You were right on top of it to help me out there. I'm pretty zonked out. It was 2 hours. I was just laying there. I fell asleep for a minute, so it was pretty chill. Yeah, I'm ready to see. I'm ready for the next phase.
Next step. That was the hard. The hard phase was the extraction, which we did great. We punched for 1 hour 45 minutes. We got 2,356 grafts. So next step, I'm gonna numb it, make the sites, and I'm gonna place it. Ready?
Yeah, let's do it.
Excellent.